Hello, everyone, and welcome to this Patients Like Me panel, where we'll be discussing navigating mental health. Today, we have two of our community leaders joining us, Lee and Rosie. Thank you so much for being with us today.
You're welcome.
I'm excited to chat with you about your experiences with mental health and the ways in which you tap into your community, the ways in which you find support, and the ways in which you navigate those hard days. So before we begin with our questions, I just wanted to know if you could introduce yourselves and talk a little bit about your experiences with mental health. Lee, would you like to start?
Sure. So my name is Lee Frost. I'm from the Boston area, and I was diagnosed with complex PTSD at the age of 51, almost exactly 3 years ago. So I struggled for many years without really understanding what the issue was. They told me it was generalized anxiety disorder, but it wasn't the right fit. Um, so it's been a journey since then, and I've been finding my resources and making a lot of progress in my healing journey.
Amazing. And Rosie, what about you?
Hi, my name's Rosie Stanball, and I live in Central Florida, which just had those two hurricanes. And that'll affect your mental health, especially when you see the results. That's been challenging not to let it overwhelm me. But I just say a lot of prayers and just try not to let myself get into that. But I started with depression after I had my first child. I had depression as a child, but I didn't know it. And then after I had our son, I found myself being depressed, but I didn't know I was depressed. But I figured out something was wrong. So I worked in a clinic in an x ray department and went to a psychiatrist there. And he navigated a lot with me and helped me understand everything going on. And he tried me on medications, but that was back in 1976. And the medications were not, they had a lot of side effects and I couldn't tolerate them. So I just had to not take medication for not until I was in my 40s. So that
Wow.
was a long time. But with all that, I went through a lot of things health wise. Had brain surgery twice that knocked my fibromyalgia into high gear. And then I just continued to struggle to do what I needed. And I worked a very intense job. And then good old menopause came along and knocked me further. And I started having major depressive disorder, which I didn't understand, but some things happened on my job that knocked me further into trouble. And I went to a therapist and he helped me understand what was going on and got me back on my feet. And I've just done well. And I go to therapy when I get in trouble. And in between, I take my medicine and count on my backups.
Yeah, absolutely. Speaking of therapy, what's your advice for someone who's just starting on a therapeutic journey and looking for mental health supports?
And that's me, Rosie, you're talking to.
Either of you, yeah.
Okay. In my experience, I know my first journey was hard because trying to make that phone call and know you need help and you're confused and you're not sure what you need is a big deal. But once you do, that's very helpful. And then I was blessed to have a man that was just super. He was a psychiatrist, not a psychotherapist. But at that time, that's how things were done. And he was really helpful to help me understand a lot more than I knew I needed to understand. And so I was so grateful that I was didn't let my fear keep me from making that phone call.
Absolutely. And what about you, Lee?
I would say for someone just starting out, if you're employed, if you don't know where to start, if you're employed and have access to an employee assistance program, that's a great place to start. That's how I wound up getting connected to the resources that I actually found. And when it comes to something like complex PTSD, trauma-informed care is essential. And it's really difficult to get appointments these days. I mean, according to the State of Mental Health America's report, around 60 million people in the US have experienced a mental illness in the past year. And around half of those have no treatment because of lack of access or not being able to afford it. So I just want to recognize that it's a struggle for so many people.
Totally.
It took me 3 years to find the right therapist to help me with my needs. And to be honest, most of the effective programs I've had have not been covered by insurance, but I've been lucky to pull the resources together on my own. I would also recommend there are tons of free conferences about mental health out there, and it's a good way to get introduced to all the different programs that are out there.
Yeah, absolutely. That's really good advice. Rosie, you had mentioned, fear around seeking mental health supports, and I'm just curious what your experience is around stigma or discrimination, or if you've experienced anything like that in the time that you've been diagnosed.
No. And
Okay.
that in the mental health part of it, I have fibromyalgia. And oh my Lord, I've experienced so much discrimination, stigma from doctors. Woo. They really have given a lot of grief. I've experienced, I have a shunt from my brain surgery, and it had developed a pseudocyst, and I had this thing going on for 3 years. And all my doctors, my medical doctor, my rheumatologist, everybody thought it was my fibro. And I mean, I was in trouble, but nobody knew. And finally, I had trouble where I threw up one night when I was asleep. Well, that isn't good. So my doctor did a CAT scan and they found this thing, and they immediately got me the help I needed. I went back to Shands in Gainesville and they drained it. What had happened, I had gallbladder surgery, and this shunt got moved and somehow filled up as big as a baby's head with fluid, and it was crushing my bowels, it was crushing my ribs. I mean, my whole body was having a terrible time. And I was in the hospital 3 times with chest pains, and it was all like, we don't know what's going on. But anyway, I got over that. And once I did, I do not let people say, well, your fibromyalgia is causing that. I always say, no, we're not going to start there. We're going to start finding out what's wrong. And if you can't find something, maybe blame that. So I've become a very strong advocate, because you have to speak up. And even my doctors I worked for told me, my boss, who was a female, said, Rosie, you could have died. You did not, before my brain surgery, she said, you just didn't really complain loud enough. I said, well, I told them what was going on. Why should I have to scream and yell and pitch a fit? So, apparently that might be what you have to do if something really is wrong and you don't know how to get the attention you need.
Absolutely. Absolutely. Yeah. What about you, Lee? Any thoughts?
Yeah, I've experienced a lot of bias over the years. It's been very difficult to get help with chronic pain. I had endometriosis for nearly 30 years and fibroid tumors, and that led to some terrible medical issues a couple of years ago. And I finally got scheduled for the surgery I needed. And I was put on a prescription medication to hold me over while we waited for surgery. But unfortunately, I was one of that tiny percentage of people who had a toxic reaction to the medication, and I nearly died. My brainstem, my nervous system were in the process of shutting down. The cognitive issues were severe, and had been recently diagnosed with CPTSD, and in the ER, I just happened to blurt that out, and all sense of urgency just stopped. Everyone just like stood back. They said, "Oh, it's a panic attack. Just go home."
Wow.
And I nearly wrote it out in a hearse as a result. But we went to another hospital. They were able to help me. And that is the incident, which is why I became so passionate about becoming an advocate for bringing trauma-informed care into widespread practice in healthcare, and even started a side gig to do this work. So it's always top of mind of what I went through, unfortunately, and it caused a whole new layer of trauma that I'm still working through.
Yeah.
Yeah, that makes total sense. So what does your self-care routine look like, Lee? How do you take care of yourself?
Somatic therapy is my go-to. So that is the process of learning how to free yourself from carrying all this tension in your body from chronic stress. And the best programs it's a bit of a medical school course. They teach you the biology of stress, and then they move into body work and kind of like meditation exercises to teach you how to tune into your body and to listen to what your nervous system is trying to communicate. It's about learning how to sit with really uncomfortable feelings, to acknowledge them, and then over time, you learn how to move and hold yourself with more ease. And I also had to make a ton of lifestyle changes in order to manage things better. I used to work myself sick all the time and never get more than 5 hours of sleep. So I'm really careful about that now. I live with chronic pain, so working out is a challenge, but I do the best I can. And I also do a lot of journaling and art therapy.
Amazing, amazing. It's a pretty comprehensive approach to self-care. I'm impressed. I need to get on the track of doing more of those things for sure. And what about you, Rosie?
Well, for my self care, like I told you, because of what happened in that one experience, I'm very much an advocate because you have to stand up when you know something's wrong. You have to um, get the help you need, and you don't just allow, even though doctors are doctors, they're practicing medicine and they're wonderful and we need them, but we're inside the body that's having the problem. And we have to let them know, I don't care how many times. And I also, in my fibromyalgia journey with the mental health, when you're in pain, as Lee's saying, you have to deal with so many things. So I was always researching, and I ended up going to a pain clinic. It's the strangest experience, and went on ketamine infusions. And I've stopped everything with the ketamine now. I just did that recently because most of my problem now is osteoarthritis issues. And my fibromyalgia seems to be taking a little vacation, thank God.
Yeah, that's
But
good.
mine was so severe that and it happened after my brain surgery. It was just all the trauma things that happened. But I was able to get the help I needed through this doctor, and he's directed my care. And then because of that, I've been able to do what I enjoy. Before, I couldn't do much of anything. I was too in pain, just
Yep.
focus, couldn't, whatever. And I stayed on Patients Like Me all day long. That was a wonderful tool. That's something I would recommend to anybody because you get so much encouragement. And then I also I like to read. I like to color. I'm very artistic. I like to make quilts, but that's challenging physically. You have to get up and down, and your head has to be working good, and this and
Right.
that. So I do that, and I like to be with my family. And so our son and daughter-in-law live with us, and at night my son and my husband watch sports and Jeopardy and this and that. Well, I have ADHD too, so I can't just sit still while my husband's flipping 20 channels. So I sit there and I read, or I color, or I do Sudoku or something. I cannot just focus. Now, if I go to a movie theater, I can watch a movie, but not the TV. I like to cook once a day for my family because that I feel like that's my contribution to our household. I take care of the orders and the groceries and keep things stocked up. And then I like to clean up the kitchen. Crazy
Nice.
woman. I'd rather somebody cook for me, but I do it because it's a good thing. Somebody needs to take care of that. And I try to make it work healthy for us. And I try to keep my medical appointments. That's important. That's a self-care because I went quite a while without a mammogram, but I finally got that done and it's good. Um, I try to be helpful to others. I have friends. I can't get out and hang out and do stuff a lot because physically it's not going to work. But I do help a little bit in our youth group. I go in and clean up the kitchen after their snacks and get their snacks out and things like that for a couple hours a week. And I do a couple other things at church that are not real physically active, and that keeps me happy. And then I like my family to come over. I have two sons, two grandsons, and one granddaughter. And so when everybody comes, it's quite a group, but it's a lot of work, so I can't do it that way. So we order pizza and we keep it simple. And then for birthdays, we celebrate here at our home. And my husband and my son and daughter-in-law help me tremendously. They know that we all have to be in this together.
Absolutely.
And they have mental health issues. My son has bipolar, and my husband has major depressive disorder. So I don't know if you want me to talk about that now or say that for a
Sure,
minute.
absolutely. Yeah. How does your family cope with mental health stuff?
Well, what we do, my son and my husband are very quiet people, and my daughter-in-law, and I'm not. And so I tell them sometimes, look, y'all, we're going to do it in my personality. We're going to have this party in a happy, chipper talk, and y'all just sit there and be a part of it versus in your mode of quietness. Because in people like my husband would just as soon not do all the things I want to do, but it's okay. We agree that we'll just do it in that moment, and he goes through it and helps me. He's cooperative. And then if we want to go on a trip or something, he has macular degeneration as a young person. He inherited it from his grandfather. So he was able to actually drive until 2020, which is a miracle, but it had to do with these red glasses he wore that took the glare out. But in 2020, everything got a lot worse. And in Florida, the citrus died, and he was a citrus grower. I always said he came out of the womb saying, tractor, tractor. We have about four at the barn. And so we grew citrus, and he cared for other people's. And when all that died out, it was really crushing. About the same time our son's bipolar came upon him. He was 36 years old.
Wow.
I mean, it was something. He was under a lot of stress at call. He was in a program for his PhD, which he was never able to finish. He was down to writing the dissertation, but he really went through a lot, and all that was a big challenge. But see, patients like me again jumped in there, and oh my goodness, I switched from the fibromyalgia community to the mental health community, and I found out that's really where I belong. I just met people and got along so good and learned so much. They kept me balanced because I just had no clue how to cope with all of it. It was really rough. He's stable now, and I had his permission and my husband's to mention them.
Yep.
And we respect each other. They respect my chatty Cathy personality, and I respect that they don't always want to listen or answer my questions. I have to go on the internet. But it all works for us, and we're very fortunate.
Gotcha. Gotcha. And Lee, how do you navigate your support system and your loved ones? How do they show up for you?
Well, I'm really fortunate to be married to a guy who understands. He's had to help me navigate so many of these medical problems and all these trips to the hospital. So once I got diagnosed, it really helped us understand the root cause of the problems that I've had
Mhm.
over the years, because like Rosie was talking about with menopause, symptoms actually get worse during the menopausal transition, and it's actually worse for people with mental health issues. And that was something that was like super important to help me understand. And my husband's really awesome at reading me. He can pick up on when I'm feeling off. So we're really comfortable communicating with each other. In terms of like the rest of my family, I come from a really salty old New England family that's not very open emotionally. So this was really new ground for us. And we're small, fragmented. It was difficult at first, but my mom and I are especially close. And we're in touch frequently and do our best to support each other. And ever since I've been very public with my advocacy work, it's helped us open up more with each other. And I feel like our connections deepened as a result, which is a really good thing.
Amazing. Yeah, of course. Of course. So, what have been some of the most challenging parts of living with your conditions? Either of you can start. Lee, if you want to start.
Sure. I mean, it's not knowing what was happening for all those years. I mean, to be diagnosed at 51, I it was like playing a video game on hard mode and not understanding that you were playing on survival mode, and knowing that CPTSD is connected to a whole array of medical problems from autoimmune and endometriosis and all this other stuff. Um, that would have been really helpful information to have years ago. And it's recognized internationally, but it's not on the DSM in the US. So
Mm,
it's a real struggle to even get there in the first place with the diagnosis.
yep, yep. And Rosie, what about you? What's been difficult?
Well, in my younger days, it was really hard because I was just, I worked and sometimes I worked full time, sometimes I worked part time. My children, my oldest son was sick all the time until he was about 3. I took him, he was allergy tested and he wasn't sick again until he was 8. And that was tonsil problems.
Mhm.
And it was just so overwhelming for me all the time because of, I don't know if it was my nature, superwoman. It was a myth, but I hadn't been told that yet. And at times I'd be so worn out or whatever, I would isolate. My mother did that really bad. And so it was something I knew. And I remember one time isolating. And what I mean by that, I'd come home after the job, the kids, the dinner, the sports, whatever, and I'd go off and be by myself. I would just had to do that, and then my brain wasn't involved with the kids, with my husband, and he would take over. He never complained. And then maybe 6 months later, it's like I'd wake up and say, well, what's been going on? It was really kind of scary.
Mhm.
But I did that at times during the years I worked. And that was hard. And then the depression things were very hard when I would go through. What threw me into that major depressive disorder was so many things. I had in 2000, the 2 brain surgeries. Then we had a house fire not December of that year, but the next year. And then I went through menopause and I had a very high intense job, CT scans that I had just learned and was doing. And all my patients were the sickest of our clinics. So I was sick all the time. I
Mhm.
only worked 25 hours a week, but I was sick and sick and sick. And then with upper respiratory. And then my printer for my film wouldn't work right. And this is a $35,000 machine, and my boss would not get a warranty on it. And every time they came to mess with it, it was $5,000. And I should have just said, when y'all get it fixed, I'll come back and do this. But I was so intent on trying to make it all work. It was a nightmare. And that's what threw me over the edge. I didn't know I went over the edge, but I did. And it took me about 4 months to realize something was really bad, out of order. And we had gone on a retreat, and everybody there was just sparking and happy as a couples retreat. And I was like a dead wash rag. I mean, I had no strength. I was just wiped out. We were outside and we were supposed to be doing climbing things and all this stuff. And we didn't know it was going to be that kind of a retreat. We thought it was just an inside thing. But anyway, I looked around me and I thought, what is wrong? Something's wrong with me. Nothing's going on with these other people. And I knew all these people. But anyway, that's when I realized something wasn't right. I mean, how many months went by? I didn't have a clue. I was so busy trying to make life work.
Yep.
So I called and got an appointment and went to this gentleman for 3 years. He really helped me a lot. And I had a lot of medical issues on top of all that. My teeth had problems. I had to have some permanent teeth taken out and some implants put in. Just, it was one big thing after another. So it was a financial thing. It was a stress. It was everything. And that just was a rough time for me. The biggest thing, because sometimes I don't have a clue that I'm not in good shape. And I do now a little bit better because I don't have so many responsibilities. Now I'm retired. I can get up and not have anything that I have to do. It's a blessing.
Right.
And I realize now I should have left my job after my brain surgeries instead of thinking I was still the same person. And I pushed, it's like what Lee said, I pushed and pushed and pushed. And then I finally, fortunately, my bosses had hired a girl to help me for a couple years, and she knew my job inside out. So I just went and said, I'm giving my 2 weeks. I didn't have to help anybody learn. I just got to walk away. And then I thought I was going to get on well. No, I didn't get well. I had a bunch of autoimmune problems. Plus, there was something a pneumonia shot helped me with. I went to a specialist for your blood and all that to find out why I was not a healthy person. And whatever it was, this medicine helped give my immune system what it needed. There were like 10 components my immune system didn't have. So that's why I was sick all the time. Then I started getting better. Then I had to deal with the shunt problem. I mean, it's never a dull moment, but it seems like Lee's talking about her things. When a person is having many autoimmune and many this and that, you really have a lot of things that, and a lot of it's genetics.
Absolutely. So I'm really fortunate to have a community around me to help me with my mental health. And based on what I've heard from both of you, you also have a great support system. But what's your advice for someone who's lacking community or support? Where would you tell them to start, or what would you tell them to do to build up those supports? Lee, would you like to hop in?
Yeah, this is something I collect resources. Like I literally have like a library of sources for mental health and trauma-informed care. And there are tons of online spaces, like even outside of social media. Like I find that there are a lot of helpful groups within social media, but in September, there was a new one for CPTSD called Healing in CPTSD that I joined. And it's nice because everyone gets it there and you can just talk. And then there are other sources. I know there's like cococares.org, which is an online mental health that's free for everybody. It's also integrated into several social media apps. So if you start talking about mental health stuff, it might proactively reach out to you. and can help you direct you to resources. There are tons of online conferences for various mental health issues, and usually the speakers run their own programs. And so it's kind of a sampler of what's out there, and you get directed to YouTube channels and all these other spaces where you can at least start to learn about the issues and find ways of getting help.
Absolutely. Yeah, that's all great advice. Rosie, what about you? What do you think could help people to build up a support network?
Well, one thing I thought about is that maybe they could start with going to a therapist if they're brave enough, or if they realize that they need that type of talking help.
Yep.
Then that therapist can help that person work through and figure out how to set up a support system, how to do self-care, how to. One thing I've found, like my sister's single, and she has so many friends and she's so active and busy and blah, blah, blah. But I know so many people that are single and they're not like that. And I told her, I said, you need to write a book, because everybody isn't like you, but you could really help others understand. Because some people, it's just like me saying, go to a therapist or set up a support system. Well, some people wouldn't even know where to begin. So I would think, like Lee said, that you could go through your employer and maybe get some direction, or you could go through your insurance and see who's in your plan, that sort of thing.
Yep.
Or you could talk to your friends, or you can go online. I mean, I'm always on the internet. I want that on my tombstone. That girl loved information, and she's always on the internet, because you can find out a lot. Because many things we don't know where to start. And that's good. And some people don't have a support system, because I know my sister-in-law has bipolar, anxiety disorder, and it's very hard for her to be around people. It's difficult. And so she doesn't know, first of all, she doesn't really want to be there. And second of all, a lot of people don't really want to be with her, because when she is around you, there's complications. So it's, everybody doesn't fit the same mold.
Yeah, absolutely. Yeah, that all was wonderful advice, and I thank you for sharing your stories today. Is there anything else that either of you would like to add for our community before we close our conversation today?
One thing that helped me was, I think it's called FAMI. Is that right?
NAMI?
NAMI. Remember, I had brain surgery. Just kidding.
Right. Yeah.
I fall back on that. But NAMI, a friend of ours gave me a book from that, because we didn't have any places in our area. And that book, I read it from head to toe. I went and had it printed at somewhere and had 3 books printed, one for my son with bipolar who never read it, one for my other son, so he would be aware and understand some things he didn't understand about it with his brother. And I wish there were meetings near, but there weren't. And at the time, I don't believe Zoom and online was so popular that any of us knew about that.
Right.
So I think those are good resources too. And YouTube
Absolutely.
is great.
Great advice. Lee?
I would say my best advice is stay informed and be strong about advocating for yourself.
Yes.
The research in neuroscience is really still kind of new. And so just learning how it works on a physiological level is important, so that you can educate the healthcare providers around you about it. And just stay strong. And it amazed me recently. There was a stat, fewer than 1% of studies in neuroscience focused on women.
Yeah.
And there's a whole new institute, I can't remember which university it's associated with, where they're dedicated to that now. So
Great.
it's really important to try to follow the news wherever you can.
Yeah.
Absolutely. Absolutely. That makes perfect sense.
Mhm.
Well, I can't thank either of you enough. Rosie, Lee, thank you for taking your time, spending your energy, sharing, being vulnerable. I really appreciate both of you, and I'm so glad you're community leaders here at Patients Like Me. I hope you all have a wonderful day, and thanks again.
Thank you so much.
Thank you for inviting me.
All right. Have a good one.